One of the reasons that we do hospitalizations and characterize people's seizures with the video component and the EEG component is to further their treatment. It will turn out that about 1 in 4 people who actually were saying they had seizures or had been told they have seizures actually turn out not to have seizures, but a condition known as non-epileptic events. These are episodes of shaking or staring, things that have been interpreted by other physicians and other caregivers as seizures, but there are none of the brainwave changes that we see that come along with those brain cells that aren't doing what they're supposed to do. And in the absence of those brainwave changes, we know that the episode is not a seizure. These have been historically referred to as pseudo seizures. I don't personally like that term because most people know the word pseudo kind of refers to false, and they've already been kind of delivered the message maybe in the past that their episodes weren't seizures, and they've been given miscommunications. They think that they've been told that they were making them up. They're phony because they're making them up. 3 things are absolutely true. Number 1, these individuals are not making up their seizures. If they could stop them, they'd do it in a heartbeat. Number 2, they're absolutely real, and they need to be treated. And number 3, they're not a sign of craziness. Whenever I say these are motivated by psychological issues, the next thing every patient will think is, oh, he just thinks I'm crazy. But the answer is no. No, I don't think of this as craziness. What we've come to understand is most of this is associated with what's called post-traumatic stress disorder, or PTSD. I know most people think of PTSD and they immediately think of Vietnam veterans or something like that, and that's simply a matter of when we actually came across the terminology. But in fact, PTSD is extremely common in our society, and people have gone through very horrific early life events, just emotional traumas that are so horrible. And as a consequence, they have difficulty in stressful environments, not particularly linked to the earlier trauma, just when the environment around them becomes more stressful. And that can be things that they don't personally appreciate are stressful. They will have these episodes. If you believe in the subconscious, and I think lots of people do, it's the subconscious's way of saying, look, you're under a lot of stress, let's just divert all the attention from that stress away from you and put it on this other thing that everybody can worry about for a while, and then, the stress will go away. And so it's a kind of a protective thing. It's important to think of it as protective because, no, most people don't get hurt with these episodes. They're not injured by them. No, it's not doing any damage to the brain. The brain is perfectly fine, and what we need to do is identify what the stressor, what was the original trauma, and if there's counseling that needs to be done about that, do that. And then we also need to give the patient some tools to actually recognize when these things are likely to happen and ways of de-escalating that stress. And I use a particular psychologist that I found years ago who does biofeedback with people and trains them to actually not get these episodes. And this is very successful, 85% success rate. There are no medicines for this. In fact, continuing to take seizure medications can be detrimental. And in fact, it's very common that patients will report that the more medicines, the more seizure medicines they were put on, the more often these episodes happen. But the key is not walking away. All too commonly, physicians say, well, this is a psychological problem, and they do an about-face and they disappear. And that commonly gets transferred to the patient emotionally as abandonment. Okay, and you can say you're not crazy as much as you want, but if you disappear, then that becomes an issue. So it's very important that the patient go to the psychologist. There's one particular psychologist that I use at the hand clinic at Frederick Hospital. who does, by the name of Dr. Mark Rush, who does a fabulous job. And I've really had excellent results with our combination, so about 85% event-free. And we do a tag team. So the patient comes back and sees me. We continue to answer any questions, resolve any issues. And when the patient stops making follow-up appointments, then I know that the problem's been solved.